Welcome to lesson 29, Determining Cleaning Effectiveness. In this lesson, we are going to be looking at how clean is clean, visual examinations, riboflavin testing, sampling, recovery studies, verification of effective cleaning. So how clean is clean? We can have two ways of looking at it. We look at the quantitative, where we are going to test our analysis and we're going to require sampling to do that, or we can have qualitative, where we're only looking at a visual inspection. The visual inspection, as we mentioned in our previous lessons, is very subjective. Biological cleanliness, then, we're looking at bioburden limits and viable microbes, endotoxin limit and toxins associated with certain bacteria. And the analysis to ascertain that will be TBC plating, LALs, or endotoxin testing. Physical cleanliness, then, depends on particulate contamination limits, airborne matter, or dust. And that would be analysed using particle counters. For chemical cleanliness, we're looking at product residue, so that could be active or excipient. We're also looking at decomposition residues, and decomposition residues could come from the active product or the excipient. They could come from the detergents that were used as part of the cleaning cycle. They could come from acids or alkalis. They could be bacterial. You could have mold, pyrogens, degraded protein actives, or you could have detergent residue limits coming out of your cleaning agents, or you could have solvent residue limits. To ascertain that, we would be sampling. Our sampling would come of one of two ways. We would either swab or we would rinse. And then we would take our sample and we would do analysis. Typical types of analysis might be using HPLC, the high performance liquid chromatography, NIR, total organic carbon, TOC, AA, ELSA, or conductivity testing. Visual examination. Visual examination is where the observer makes an immediate determination of equipment cleanliness. It is subjective, so good training and SOP is vital. The equipment must be dry in order to see residues better, and torches and mirrors are often used for difficult to see places. Examination can be enhanced by passing a UV light over the surface. Residues will fluoresce for API actives in certain cases when irradiated with UV light. Another means is to use dyes, so these either fluoresce on their own or form coloured complexes with certain residues. Riboflavin testing is used a lot in cleaning validation, and it plays a huge role in the sanitary process solutions and help confirm cleanability of equipment. Riboflavin is a yellow vitamin that glows under a black light or a UVA light. Riboflavin is mixed with water and sprayed throughout the wash chamber. The tank or other target items being tested for cleanability. The testing involves coating all surfaces to be cleaned with a riboflavin solution. Surfaces are then cleaned as per the normal cleaning procedure. Critical cleaning points are visually checked. They are visually checked for fluoresced material using the UV light, so it makes it very easy to see any areas that are difficult to clean or that have not been cleaned correctly according to your procedure. Riboflavin is an excellent candidate for checking the cleaning of a tank with the spray ball assembly, your clean in-place system. It also checks the correct positioning of the spray ball for coverage testing. When we're using a spray ball, we need to be sure that the spray is catching all areas of the inside of the vessel, and this is an excellent way to do that. Where you have no visible fluorescent, it verifies that you have complete cleaning spray coverage, so everything has been cleaned properly and all areas were captured by the spray ball. If there is a residue showing, the field engineers can then determine where the spray device coverage is not reaching and the spray ball position might need to be changed as a result of that. Why do we perform sampling? Well, we need to evaluate and to verify the cleaning method. It is vital to sample the product contact surfaces of the processing equipment and to establish the level of residue. Choice of sampling and analytical method will depend on the nature of the residue and the manufacturing equipment. Sampling diagrams should be prepared, and these will indicate the actual locations to be sampled and the methods for sampling also. Critical areas or areas that are difficult to clean are particularly important to sample. Sampling. The objective of sampling is to establish a reproducible level of recovery from the equipment surface. So if there is a residue there, are we able to take it back off and can we quantify it? There's two methods to do this. We can do it by direct sampling, i.e. using a swab, like you can see in the diagram here. Direct sampling, i.e. swabbing. So you can see in your diagram here, Your precise area that needs to be swabbed is marked out. You take your swab and you swab in a particular motion, which would be defined in your procedure or in your protocol. The second method is an indirect sampling. So here you are taking a volume of the final rinsing. So that would be a volume of a typical 500 to 1000 mils that's collected after your cleaning procedure is finished at the very end of the final rinsing. So you're checking that to see if there is any residues left in it. Analytical limits. So you can do different types of testing. You might want to test for a non-specific analyte. In that case, you might be just looking at pH, conductivity, or a TOC, total organic carbon. If you specifically want to know the amount of analyte and what the analyte is, then you would be looking at something more complex, like a HPLC, a high-performance liquid chromatography, a gas chromatography, or something like a mass spectrometer. The level of detection must be known so that you can select the right method. You need to know what your limits are and what your expected results should be. The analytical method has to be validated before the cleaning validation study can be carried out, so you need to have assurance that your method is working effectively prior to any cleaning validation. The analytical methods must be challenged in combination with the sampling method, so you need to know that your analytical methods work and also that your sampling method is getting back and recovering any residues that may be present. The contaminants can be recovered from the equipment surface, and the level of recovery, it can be detected and it is above the limit of detection of the analytical method that you have chosen. There needs to also be consistency of recovery. Indirect sampling. In indirect sampling, you're looking at the rinse sampling, and this involves using a liquid to cover the surfaces that are to be sampled. The single point final rinse sample is obtained at the end of the final rinsing process. So this would typically be water or a solvent sample. You're typically going to take 500 to 1000 mils and collect that, and the sampling point is at the end of the cleaning circuit so that you have all of the areas of the interior of the equipment captured at this point. So the advantages are that it's a large surface area is available. You need to make sure that the solubility of your contaminant. Inaccessible items that are washed can be tested by doing this, where you can't do direct swabbing. It's a very simple technique, and it provides an overall measure of the possible contamination of the system. Direct sampling. A swab or a wipe is commonly used. They are made of fibrous materials that is used to wipe a surface to remove residues from the surface. The swab head is typically wetted with solvent or alcohol, water, or both, which aids the solubilization and the physical removal of surface residues. It is then wiped across the fixed surface area of the surface to be sampled. And you might use a template like this, or you might have some other means of identifying what size of a surface area you will be sampling. The residue is then extracted or deabsorbed from the head into a suitable solvent for analysis. Swab issues. Suitability of material in the medium. So it needs to be non-shedding, knitted polyester fabric. The recoverability. It has to have a low extractable grades to minimize any interference. And selection of solvents. The target residue may be soluble in the organic solvent. If you are using TOC as your analytical method, then you cannot use an organic solvent as your cleaning solution. The number of swabs, you may need 1 or 2 per target surface. One swab may not pick up all the residue. A finite amount of solvent will be left, which contains the target residue. The second swab then may be needed to pick that remaining residue up. And to enhance recovery, the swab will generally be dry, so to mop up the solvent residue. Swab issues. The surface area swab varies from 25 to 100 centimetres square per site. The location as per the plan that's identified during your scale-up or your pre-qualification run. The swabbing pattern is generally that you swab across in one direction and you flip the swab and swab again in the other direction. Handling. It should be handled with gloved hands and the movement needs to be minimised. All of the above information would be noted in your cleaning validation protocol, your SOP or your trial. So there's different types of sampling you can do. The first one we're going to talk about here is a placebo sample. So use a substance to mimic the action of the product in the equipment. So for example, lactose. And here it's very useful for active residues, cleaning agents and microbial testing. It's used predominantly to demonstrate the lack of carryover into the next batch. The next type of sampling is product sampling. It's similar to the placebo except you're using actual product. You need to closely examine the next production batch for any trace of residuals of the previous batch. Direct surface monitoring. Here we're going to evaluate the direct surface cleanliness without any surface contact. and that is done by using measurements of bioluminescence or spectrophotometric probes, substances that bind to residues and they're noticed, for example, in the UV light. Recovery studies. Recovery studies are used in advance of a cleaning validation to ascertain how the recovery of the residues will be in the main cleaning validation. In these, you would add fixed amounts of target residue spiked onto a model surface, like a stainless steel coupon, for example. The spiked residue is recovered either by using a swab wet with solvent or with a known volume of solvent to represent the final rinse of the cleaning procedure. The recovery factor is the amount of residue recovered compared to the amount of residue spiked on the coupon. So you wanted to make sure you get as close to 100% back in your recovery as is possible. For example, if your contamination is 12 micrograms per swab, the recovery is 75%, then you know your potential contamination was 16 micrograms per swab. Using a rinse example, if your rinse sample was 1 litre and you found 5 ppms of product present, so 5 parts per million of product present, your total volume of rinse is 1000 litres. Therefore, you've got 5 milligrams per 1000 present, which gives you 5 grams. It's vital to do like with like, so where you're talking about surfaces, quantities, swabbing and SOP adherence. We need to perform a number of replicates to prove that the consistency of results is good. The acceptable percent recoveries can be greater than 50%, but really greater than 80% would be preferable, and obviously as close as possible to 100% is ideal. Visually clean. The division between visually clean and dirty is approximately 4 micrograms per centimetre squared. Visually dirty is an indication of cleaning failure, whereas visually clean would not clearly indicate whether the residue is at an acceptable level or not. That would depend on what your acceptable limits are and whether or not your material is visible to the naked eye. Examination can be enhanced by passing a UV light over the surface. This is effective for residues which fluoresce when irradiated with UV light, and that method is often used during cleaning validation, like the riboflavin, which we already discussed. Verification of effective cleaning. So a question, should we swab the hardest to clean area and then extrapolate the results for the rest of the vessel? It is an option, but it could be a tad unrealistic. You might result in having unnecessary cleaning, and that affects the reduced plant capacity. You're holding up equipment that is needed to be in production with cleaning processes. It requires a lot more time and a lot more effort. You're using extra detergents, extra solvent and extra water, which has a cost effect. If you give an example to say that your carryover limit for a vessel is 100 micrograms and your total surface area of your tank is 100,000 square inches, if you take a swab which is 2 inches by 2 inches, so it's 4 square inches, we might find 0.1 milligrams on the swab. That would mean your total residue is 0.1, the amount you found in the swab, multiplied by the surface area of the tank, divided by the area of the swab, giving you 2,500 milligrams. Numerical calculation of acceptance criteria. Acceptance criteria must be set for the following items during cleaning validation: residues of active ingredients, residues of chemical raw materials and intermediates, residues of cleaning agents, microbial residues and endotoxins. We are going to be looking at some of the numerical calculations for these type of acceptance limits in our next lesson. Can you test until clean? It is usually not considered acceptable to test until clean. This concept involves cleaning, sampling and testing with repetition of this sequence until an acceptable residue limit is attained. For the system or equipment with a validated cleaning process, the practice of test until clean shouldn't be required. The practice of test until clean is not considered to replace the need to validate cleaning procedures. Over to you. What is cleaning validation trying to determine? What are the 2 ways to sample? What are the potential pitfalls when sampling? Thank you very much for your time and attention. We'll see you for the next slide.